This program is about low back pain. Low back pain is the most common reason that a patient seeks the advice of a physician. The program will be conducted by myself, Dr. Rudy Cashman, a neurosurgeon. I've been practicing neurosurgery for 35 years. A neurosurgeon generally spends 70% of his time doing spine surgery and 30% of the time doing brain surgery, tumors, hemorrhages, blood clots. With me this evening, Dr. Tom Lazoff, a physician and physiatrist. I want him to explain to you in a minute what a physiatrist does. We, between us, have about 45 years of experience in the conservative and surgical treatment of back problems. Dr. Lazoff, would you tell us what a physiatrist does?
Thank you, Rudy. A physiatrist is a physician who specializes in physical medicine and rehabilitation, as well as pain medicine. We treat spinal conditions in a conservative manner, which we'll get involved with here later in the program. The basis is to promote a healthy body on a long-term basis and in hopes of avoiding surgical intervention down the road.
Thank you, Tom. The purpose of this video, why are we doing this? For one thing, to share experience with the general public for educational purpose. That really is the main purpose. We're going to discuss the diseases. We're going to discuss the anatomy, go through the x-rays and the treatments. Also, I think, and Dr. Lazoff have developed some consensus over time that we feel there's been somewhat of a disconnect develop in this country. And I'm speaking from one end of the states to the other. In other words, back problems, I mean, some are an emergency and some are very big problems, but 80% of the spinal back problems or low back pains are fairly benign conditions. And we've been a little bit concerned that these conditions are being a bit overtreated. With modalities, with medications, we're seeing a lot of addicted patients. We see patients who've had multiple procedures who perhaps had an incorrect diagnosis. And we're going to go through this in some detail. In other words, we're trying to educate you on how to proceed if you have a back problem. We are not your treating physicians. We're just educators. I've also developed a thought over the years that medicine has become a bit too scientific. Like I go to our last medical meeting, our neurosurgery meeting, and I see a football field size hall full of new instrumentation, new type of procedures available to use for low back pain. And I walk down the hall and I see two little girls doing physiatry, giving massages in the hallway. And to me, this is out of proportion. This is out of proportion. We need to, I think, to use more conservative measures. I also feel that in medical school, we spend probably 98% of the time in very serious scientific study. I think this is a disconnect. At least a third to a fourth of what the doctors of all specialties see in the office has a great influence from the mind. I think healthcare providers have missed that the brain is connected to the rest of the body. I think that treating the rest of the body on down, treating it strictly as a scientific endeavor, having no connection to the brain. What am I speaking about? The term you hear in the paper.